Three, two, one. Liftoff.
Welcome to the Ketamine StartUp Podcast. This is where we talk about anything and everything related to ketamine clinics, startups, marketing. In today's episode, I had the pleasure of interviewing Dr. Leslie Koenig while we were attending the annual meeting of the American Society of Ketamine Physicians, Psychotherapists, and Practitioners in Austin, Texas. Leslie Koenig is a board-certified emergency physician based out of Nebraska in Omaha, who is a Navy combat veteran. We're going to talk a lot about ketamine, about her clinic, Waybridge. So please stay tuned and you can hear more about Dr. Koenig. So welcome to the Ketamine StartUp Podcast. We are here with Leslie Koenig, who is an amazing emergency physician, former Navy combat veteran, and who has her own ketamine clinic amongst other clinical activities as she does. So first off, Leslie, can you just share with us, for our listeners and viewers, a little bit about you and your background?
Sure. Well, thanks for having me on your podcast. I'm very excited to be here and share. So my background is that I'm an emergency physician, and I have a clinic in Omaha, Nebraska. We was recently opened, and so I'm excited to be able to offer this more and more to our patients as we expand and grow.
Awesome.
So yeah.
And tell us about, Leslie, can you share a little bit about your journey from being maybe a traditional healthcare provider to becoming the owner of a ketamine infusion clinic?
Yeah, that's a great question. Traditionally in medicine, I think we're taught just go to a hospital, work like you were taught in med school, do your residency, and just nose to the grindstone until you retire.
Right.
And so my journey into becoming an entrepreneur and opening my own business um, kind of really, I got interested in integrative medicine first,
Mm-hmm.
actually, just feeling like I was being very reactive in my medical practice. And though I love emergency medicine and the immediate gratification, I just knew there was more out there that was what I was capable of doing. And I started looking into integrative medicine, which I am now doing a fellowship in. However, along the way, an old buddy approached me to do a ketamine clinic. And that was once I heard that concept, I just thought, wow, why would I not do that? So the path was a little, I thought I was going to go one way. And then I heard about ketamine and what it was possible to do. And I felt like that led me in a completely different direction, which I'm so grateful for.
Yeah. And it's really interesting because your background is in emergency medicine. So I'm
hmm
curious, how did you even go down this integrative fellowship and pathway? Because that's a bit different
It
than
is.
traditional medicine.
Yeah. Well, so when I was in the Navy, I learned about acupuncture, which I was completely, I didn't believe in it whatsoever. And then I think my first really foray into, oh, there's more in the world out
Hmm.
there than what I was taught in Western medicine was I was doing a trip to South America to do a month in Bolivia. And along the way, I picked up a stomach bug, came back with stomach pain, and the antibiotics treated it, but I still had this pain.
Hmm.
And a residency buddy of mine, did acupuncture and I didn't believe in it, but I was just like, dude, can you just, you have the needles, can you just try something? Because of course Motrin's not working, Tylenol's not working. I've taken the antibiotics, but it still just hurts. He gave me the acupuncture and at first I didn't feel anything, didn't believe in it. I was like, oh, okay, thanks. And then I actually noticed in the next few hours how much better I felt. And so that opened my mind up to there's more in the world than what we've traditionally been taught. And it expanded my mind to find out things for myself. And and then once I actually found out more research and data, it was just amazing, the whole world out there.
Hmm.
And when I found out about ketamine, I had heard a little bit about it, but once I actually looked at the research and data, it was just astounding to me.
Totally.
So then I just once you start opening your mind, it just doesn't stop.
Yeah. And there's that quote like, a mind expanded to a new dimension can never go back to its original shape.
Yeah, yeah.
So, yeah, definitely mind expanding. And because you are in the emergency department, you're probably familiar with ketamine in a different way because, I used to use it when I worked in the ER all the time for
Yeah.
procedural sedation and intubation and little kids with broken bones and laceration repair. So
Yeah.
you're pretty familiar with it in a way, in a different way, of course.
Yeah, 100%. I mean, I use it for all kinds of procedural sedations in the ER, and from pediatrics to, asthmatic intubations,
Hmm.
really selectively for that. But then I additionally used it when I was in Afghanistan for combat traumas. So, and I mean, of course, ketamine is wonderful on the battlefield. So I was familiar with it from that standpoint, just because if I gave a patient ketamine before loading them up onto the Army dust off, I wouldn't worry about them, losing respirations or their blood pressure dropping, because sometimes these patients had tourniquets on them, and I was in charge of the walking blood bank, so I was giving them boatloads of blood, and it was just one less thing to worry about, because ketamine is just so safe. You can give it IM in a kinetic environment like that and not worry. So it's just such a safe, amazing medication. So yes, there was some familiarity with it. And then actually in the Navy, we used a low dose protocol for pain in the ER.
Wow.
So I introduced that to my civilian hospital and found great benefit there for patients who had already tried IV opiate. No amount of Dilaudid is helping. And then I would do this low dose ketamine protocol in the ER and found benefit.
That's
So yeah.
wonderful. Yeah, it's really useful to be able to use it for in the low dose setting in the ER. I know you've been open in your clinic now for several months now, I believe.
Mhm.
Um, what were some of the most unexpected challenges that you faced when you were setting up your practice?
I think the hardest part was really committing to doing it.
Mm.
The fear mindset that I had to overcome myself. It was just, once the decision was made, it felt like this is the right thing to do. So it was really, the hardest part was knowing, am I capable or not? Is this what I want to do? And also the fear mindset of what will people think?
Yeah.
And overcoming that idea that someone somewhere that I don't know might judge me,
Hmm.
and really opening up to that it doesn't matter, because I need to think about my patients first.
Yeah.
And that's who I'm truly need to have my integrity for. And I knew this could help based on everything that I had seen and experienced.
And that's really powerful because in medicine, it is very slow to change. And sometimes we are hypercritical of our colleagues, especially if they're doing something brand new and novel. Like I remember hearing the story about Dr. Semmelweis, who was the first proponent of hand washing back in the 1800s.
Yeah.
And everyone was like, this guy is insane. Don't wash your hands. You don't need to do this. And he was trying to convince his colleagues, like, hey, we need to wash our hands before we deliver these moms. And he showed them the data, he showed them the evidence, but still for like 50 years I don't think anyone adopted that practice, which of course today is now very commonplace.
Yeah, that today an earlier presenter said, Max Planck said, science changes one funeral at a time.
Yes.
And if you think about it, how many patients or how many people need to die before people figure out that, oh, suicidality drops with ketamine?
Right.
And how many people need to suffer decades of low quality of life with depression before
Hmm.
we figure out we can fix you, or at least substantially reduce your symptoms within weeks with ketamine?
Totally.
So,
Totally. And
yeah.
I know you're really passionate about veterans. I mean, being a veteran yourself. And I remember hearing some statistic, I think it's like 50 veterans die by suicide per day, something wild. And I was
Yeah,
just like,
more than 22.
it blew my mind
Hmm.
on how prevalent this is. So ketamine can definitely be, one component of that treatment modality.
Yeah, absolutely. And I am very passionate about it. I have lost prior service member friends to suicide,
Hmm.
and it's frustrating to know now.
Yeah.
I wish I was doing then and knew then what I know now.
Yeah.
But I can't change the past. I can simply educate now, move forward, and be a resource for people, for veterans, for my community,
Yeah.
so that they know of this option and how life-saving it can truly be.
Totally. Totally. Thank you for sharing that and being vulnerable. I'm curious, just to shift gears, what are some of the nuances between administering ketamine in either the combat setting, ED department versus like when you're doing it in your practice
Hmm.
it's in Omaha, correct? Or yeah,
Yes,
it's in
correct.
Omaha. So tell
Yes.
me like kind of the nuances between
Yeah.
that style versus in the different, hospital setting.
Yeah. I would say that it's almost entirely different. It's a completely different,
Uh-huh.
there's not even a nuance. It's like, well, for example, in the ER, when I have done this in the ER, it's in that loud clinical setting,
Mhm.
lots of beeping, no preparation. People haven't even heard about it until I've presented it about 5 minutes prior. And gosh, and then they're sitting in a hospital bed with a nurse and they're in a gown and it's like 2 a.m. And I don't know, it's just that clinical setting with, other patients screaming down the hallway. There's no set in setting. But in the clinic, we've created an entirely different atmosphere. I've prepared people by sending them meditations to do prior, what to expect with your ketamine sessions. When they enter the clinic, it's a very welcoming environment. We've made it very serene. We have blankets, we have eye masks, headphones with music, and very non-invasive monitoring as well. So again, it's not even nuanced. It's a completely different experience.
Wow, that sounds amazing. I mean, we do know that ketamine, the set and setting will impact the experience tremendously. And if there's a patient in bed number 9 screaming because there's something going on versus, hey, in a calm, serene, tranquil environment with the music and the eye shades and just a good vibe, like I think that plays a really crucial role in the experience for, because ketamine can create these non-ordinary states of consciousness. So I love how you highlight and bring that in. Leslie, as your clinic has grown and developed, what strategies or approaches have you found to be the most impactful for its success?
Oh, that's a great question. As we grow and expand, the most impactful, I'd say coming alongside our patients, having the healthcare team collaborate around them. And our clinic is growing primarily because we just take care of our patients, so they get that word of mouth. Other things that have helped with being the most successful is just always keeping just a high standard of care, I think. And then since it's my clinic, I have control.
Right.
And so it's wonderful that I get to be my own boss in that way. And when I see an issue, I can immediately take action to resolve it, should there be one. For example, we had a patient who got agitated and hit the call button, but I was in the room with another patient and my clinic coordinator was there, didn't hear it. So we just were able to add an extra layer of security with with a louder alarm system in the back as well. So just little things like that where I don't have to, and then the hospital would have been a very different thing to fix
totally. I mean, when I used to be the associate director of a ER, and I was like, I want to add a chair to the physician space, and I had to go through a committee, and it took 3 months to just order an extra chair. Versus when we own the clinic, we can actually make and implement these changes immediately.
Yeah.
Let's see. So I'm curious, based upon your experience, and this is kind of like for people who are thinking about opening up a ketamine clinic or, kind of there's a seed planted, what's one piece of advice that you would offer to any clinician looking to open up their own practice specializing in ketamine infusion? What would that one piece of advice be from you? Wisdom there.
I think the key piece of advice that I would give someone looking to open their ketamine clinic is, what is your intention? And to know truly deep down, why for you are you doing it? For me, it was something that I realized I was good at, very capable of doing. And I truly was already searching for something like this. And it was just this perfect marriage when the concept of a ketamine clinic came my way, because I've always had an interest in mental health. And I've always loved treating it in the ER. So I would say that is something that someone needs to deeply look at before deciding to open it.
I love that because, I mean, it's hard opening up a ketamine clinic, or it can be, and there's a lot of challenges. But if we don't have that, why am I doing this? What's my intention? What's my goal? A lot of times we'll just say, I don't really want to do it. I don't really care. Versus someone who has the internal motivation and a true purpose, mission, desire, they'll be able to work through those.
Yeah. There's definitely hard days where I've had to go back to that, and just because I always knew deep down, this is what I had to do. This is what I needed to do. And I knew that at a visceral level.
Wow.
So that was really helped me through the hard days.
I love it. I'm getting shivers down my back as you're talking about this. Leslie, since you began this journey, in what ways have you noticed your personal mindset or outlook, perspective change or evolve? Can you share any personal growth moments where you're like, okay, I'm growing and my perspective is changing?
Sure. Let's see. So many ways have changed. I mean, as an ER doctor, how many thank yous do we get in the ER? I mean, I can probably count on one hand how many thank you letters I've gotten in the last 15 years. And yet in the and then in my clinic, I've gotten so many just right from the start.
Wow.
So it's just personally fulfilling to see directly how I can impact lives. So that's very um, fulfilling as a physician. But
Nice.
then personally, I've been invited to do more talks about it where I can speak more on what it's been like, and I can share my personal story and kind of look back on my career and say I've had these successes, and I have put my education and knowledge and the entrepreneurial mindset towards something good for people. So knowing that I am capable of doing it and changing my community
Right.
for the better, really. And again, you may hear it's hard to find words when you find yourself so deeply changed by recognizing what a force for good you're doing in your life now.
I love this. It reminds me of the concept of ikigai, of
Yeah.
finding your purpose, finding your mission, how everything is aligning with the time and your specific unique skill set and what the community needs. It seems like a perfect storm in a way to do what you're doing. And now, a quick word for our aspiring ketamine clinic founders out there. If you've tuned into our episode today, chances are you're curious about the ins and outs of starting up a ketamine clinic. It's an exciting field, but let's face it, the journey from idea to actually opening day can be quite daunting. That's why we've created something special for you. Think of it as your personal roadmap, a free downloadable checklist that lays out the essential steps you need to consider when starting up your own ketamine clinic. This checklist is designed to help you avoid common pitfalls and launch your trajectory to success. So how can you get your hands on this checklist? Simple. Just visit www.ketaminestartup.com/checklist and grab your free copy today. We've made it easy and accessible because we believe in supporting our community with valuable resources. ketaminestartup.com/checklist. All right, let's get back to our discussion. Stay tuned and don't forget to download your free checklist during or after the podcast. So I would love to hear a story or an experience from your clinic that kind of reflects and epitomizes your approach to patient care. So maybe there's one patient you can think of, or someone who's like, wow, we were able to really use our unique style at the clinic to help them and support them for their healing.
Oh man, that's a tough question. That just gets down to how my clinic has differentiated our care towards patients. Well, we're the only one in our region that does that, but I feel like I just put my entire self
Hmm.
into every encounter. So I bring my integrative mindset, I bring the alternative approaches. For example, one thing that we do is aromatherapy, and patients may not understand why. They may be like, "Oh, lavender? No, I don't need that." And I tell them, "Well, it's not just aromatherapy, but it's also practical where I understand that control mindset and you want to know what's happening when it's happening." And so I have, the thing is I know from the ER, many patients come in feeling like they have a loss of control. And how can we give agency back to each patient
Hmm.
through their treatment? So I let them, I have like this array of essential oils. And so they get to pick one. And then they get to smell that as they go in, which goes into my meditation that I teach them, or it's pre recorded. And so that's the first thing they settle into with every treatment. So for me, it's kind of encompassing meditation, it's
Hmm.
encompassing the aromatherapy. And, as they smell the essential oil, the minute it gets stronger, because they become more sensitized to it. That's how you know the ketamine is really starting to take
Ah,
effect. So it's almost one more little guidepost for
right.
them. So not only are they focusing on a meditation that I'm doing, but they're able to breathe in the aromatherapy, realize this is getting strong, set it down, and just
Mhm.
again, it's another guidepost, another way to ease them into it with some agency, and just little things like that. We have all kinds of little things like that that we do for each patient that I haven't heard anybody else
Yeah,
do, but it's just because of my core value of putting the patient at the center of our care with that compassion
mhm.
mindset and really being detailed and intentional about every facet.
I
That
love
yeah.
that. I love that. And I remember in med school, in my neurology course, we learned that the sense of smell is the only one that bypasses the thalamus, which is like the secretary of the brain. And so using the sense of smell, especially during the ketamine therapy, can be really powerful. And I'm in California, so we're woo-woo based and we're totally cool with aromatherapy. But I love how you incorporate that because the different essential oils can trigger different things. And like I mean, I'm sure we've all had an experience where you smell that cologne or perfume and it reminds you of the trip to Italy or Spain or whatever. It can just trigger a whole host of emotions. So leveraging that can be really powerful.
Mhm.
So I know personally that juggling running a business, operating a clinic, taking care of patients, family, kids. So, what are you doing to balance all of this? And how are you juggling all the different hats you wear?
Oh, that's a great question. And I never would have anticipated this, but I feel like my spiritual practice has
Mm,
gotten deeper as I've opened this clinic. And I think that's just because that was an area of my life that I had neglected for so long, being in the ER. And so I've really surrounded myself with a spiritual community, so that I can, I don't know, some of these things come up that are just amazing to me, like what I get to do for these patients and how soul filling it is.
yeah,
Um, and so for me, that's been a wonderful way to, I don't know, open up a new side personally.
I love it.
To really connect with that, as I'm helping others connect spiritually to themselves, it's funny how I end up doing the same thing.
Wow.
Yeah,
Yeah. So, as you're healing and supporting these patients of yours, it's also in a way like healing yourself.
absolutely.
And
Yeah.
that reminds me of this classic archetype that Carl Jung talks about, the wounded healer,
Mm.
whereby the healer, by supporting and healing other people, that they're able to process and heal themselves in the whole journey for both the patient and the clinician providing it.
Yeah,
Yeah.
absolutely. And I never would have expected that.
Yeah.
But it's, as you do unto others, so you
Hmm.
do unto yourself.
Yeah.
And so as I'm healing others, I feel like I'm getting to heal myself.
Yeah.
So, and that's where it's helped me find that balance between being the business owner of the family,
Hmm.
and solo independently going off on meditation retreats and
Yes.
solo hikes and things like that.
Yeah.
The
Yeah.
books I'm reading.
That's
So,
awesome. So
yeah.
self care, but also juggling many things. That spiritual component is really, really crucial. So thank you for sharing that.
Mhm.
We do have a few questions, kind of rapid fire. And let's see. So the first question, and I love podcasts, so I'm just going to steal a couple of these questions. But what book have you gifted the most to others? You're like, man, I love this book and I'm going to give it for the holidays or birthday presents. And you may have heard this question before too, Leslie.
Well, it's because I actually have a specific one in
Uh
mind.
huh.
It's called Rich Dad Poor Dad.
Okay.
I literally give it out. I used to have copies at work
Uh huh.
and I would give it out constantly. And I think it's just because of that mindset of
Mm,
the employee where you just go to work, earn your paycheck, put away retirement and savings, and then die. And, I just, once you open your mind to there's other possibilities, you can be a business owner, you can, look into a passive income, you can look into completely other ways to use your money to work for
sure.
you, to be with your family more instead of always just go into ER to get an extra couple $100s.
Right. Right.
So I actually literally give that book to
Rich.
anybody who talks about investing, real estate, business ownership. Just it's a great book.
And what's funny is I read that book. It's by Robert Kiyosaki. I think
Mhm.
I read it in 2000 or 2001, and they actually had a game associated with it, Cash Flow. And I remember playing that game in college with my friends they were into like real estate and business.
Mhm.
That wasn't my major, but I had some friends in that department, and so we would play Cash Flow and like I'm gonna buy this and I'm gonna buy this stock and buy
Mhm.
this piece of property or buy this doodad. If you remember the doodad, hey, I'm gonna buy a boat or something,
Right.
right?
Yeah.
All right. So another question is, okay, let's say that you cannot be a physician, but you have to do some career. What do you think you would choose to do?
Can I say professional hiker? I just want to I would like be a gear tester for backpacks and shoes and
Awesome.
just go hiking around the world, just go find me on the PCT or find me in Italy on the Dolomites or circling Mont Blanc. I don't know. That's
And you know what's funny about that is I'm sure someone is on YouTube being a professional hiker and doing
yeah.
exactly that.
Oh,
So
I
it's
followed
yeah,
them.
okay.
Yeah.
Awesome.
If you're a professional YouTuber or hiker,
Yeah,
I've
you follow
probably
them.
seen your video.
Awesome. I love it. Let's see here. Another rapid fire question is what is something that you purchased in the past 1 year for, let's say, I don't know, $100 or less that has significantly impacted you, your family, clinic? What's a small purchase that you've made that you're like, cool, I really enjoyed this? And as you're thinking, I'll give you an example for
Hmm.
me. Um, And I probably bought it 2 years ago, 3 years ago, but during the pandemic, people were hoarding toilet paper. I don't know if you remember where they were hoarding it. And so I bought a bidet,
Oh,
and it's a non-electric one. It just connects. It's literally just changing out the toilet seat. And I love the bidet. It's so embarrassing. I'm gonna admit it, but I think it cost $50, $60 on Amazon. I installed it myself. And for me, it's been a game changer. But yeah, is there anything that's coming up for
that's
you?
fantastic. I love that. I actually got one for my husband a couple years ago,
Okay.
and he thought I was crazy. And the thing is, it was on his Facebook group, and everyone recommended it. And so he at first kind of scoffed at it, and then now he told all his friends. So, but
Awesome.
that again was for my husband, although it is great. Honestly, the only thing coming to mind is blue light blocker glasses, which I kind of was like, I don't know, but the truth is, they actually work.
Hmm.
I follow. I get probably get like an extra hour to two of sleep a night.
Totally.
Um, yeah. And oh, you know what? This Aura Ring changed my life. It tracks my
Ooh.
sleep. So, I mean, it's not on, I think it was like a little more than $100, but it showed me how bad my sleep was as a nocturnist in the ER, because what you don't track, you don't understand. And I didn't track my sleep until this. And then when I saw that my sleep was this like terrible scatter plot that even a AI system couldn't figure out,
Mhm.
being a nocturnist. And then when I actually looked at my data, I was appalled and realized I needed to change my life. So that's probably a small little doodad.
I love it.
Yeah.
Yeah, the Aura Ring is great. And I personally use the Fitbit Versa, which also
Hmm.
tracks my sleep. And I think it's true. If you don't measure it, you can't change it. And what gets measured gets done. So I think that's really important. Um, yeah. So I think a few more questions as we wrap up. So we're at the American Society Ketamine Physician Psychotherapist Practitioners ASKP3. It's a
Hmm.
mouthful conference, and I'm curious. You've met a lot of people here, and it seems like it's growing, and there's a lot of interest in it. What do you personally think? Because you've been in it now, and you've been studying the research. Like, what do you think the future is in this ketamine space from your perspective?
The future is huge for ketamine, and there are more things coming on the market. But I think that ketamine itself has such a wonderful place uh, in society or in medicine to create huge changes. And it's just the beginning.
Yeah.
We're just getting started. This is the frontier of medicine, the frontier of mental health. And even today, they were talking here at ASKP3 about the spiritual epidemic of this spiritual crisis, where stress is the norm, loss of sleep is the norm. People just watch TV and don't talk to their spouses or their kids. They're just connected to their phones and not to themselves inside. And ketamine hopefully can help return people to who they used to be, and getting ketamine out there in a much bigger way so people can understand themselves um, in a much more healthy way. It's a really exciting time to be a doctor.
Very cool. And as we wrap up, is there any last thoughts or comments that you want to share with the audience? Just if there's anything that we missed.
Can't think of anything right now. You've done an amazing job, and I'm excited for this podcast. You've done such great work with all of your social media, YouTube, and the Ketamine Startup course, which is how we met. So I just have to thank you really for all the work that you're doing, and for inviting me to speak and share my story.
Thank you. And I couldn't have done it without my partner and wife, Kimberly, who's amazing and who's right now upstairs watching our 3-year-old daughter. So she's super supportive. And as a matter of fact, she's kind of the lead on the podcast editing, and we'll be making more. So one last question is, where can people find out more about you if they want to stay connected with you? Do you have a website? Do you have social media? Is there
Yes.
anything that people can connect with you on?
Yeah, thanks so much for asking. The clinic is called Waybridge Clinics. That is in Omaha, Nebraska. You can find that at waybridgeclinics.com. I'm on Instagram, Leslie Koenig, MD, and Facebook, Leslie Koenig, LinkedIn. Um, yeah, I have a book, Stress Relief Survival Guide, on Amazon. Oh, and a YouTube course that's
Awesome.
free. Just Google my name on YouTube, and you can have all these resources free.
And what we will do is we promise we'll put it in all the show notes. We'll put in some of the things we talked about, the link to your book and the online course, as well as the clinic's name. And I also want to acknowledge that I pronounced your name incorrectly.
Many people
It's
do.
Koenig. It's probably because my last name's Ko, and so I'm living in my own mindset, in my own world of Koenig, but it's actually Koenig. So thank you for
No,
correcting
I think
me there.
90% of people say it that way. So
Thank you. Well, we will wrap up and call it a show.